The viral infection mpox, once limited to Africa, has now become a global concern. The WHO has declared a public health emergency as a new strain, first identified in the Democratic Republic of Congo, spreads beyond its borders. Pakistan has confirmed a case in a patient returning from a Gulf country, but it is unclear if this is the new variant or the original clade 1, while WHO and IFRC have advised against travel restrictions.
The viral infection mpox, once confined to localized outbreaks in Africa, has recently escalated into a global concern. The World Health Organization declared a public health emergency after the virus, which was first identified in Congo, spread to neighboring countries and beyond.
Spreading much more rapidly than we had seen others spread. So that's one issue. It does have quite a high case fatality rate at the moment. As mentioned, we've seen more than 500 deaths, and it's particularly dangerous for those with a weak immune system, so people who maybe have HIV or who are malnourished.
Mpox case was detected in Pakistan on Friday in a patient who had returned from a Gulf region.
The first case in 2024 has been reported in Khyber Pakhtunkhwa. We have confirmed the case through PCR test. Its sample has been sent to Islamabad for genetic sequencing. The health department is ensuring all measures regarding prevention, control, management and facilities. We have alerted all border health services team at the borders to check all the passengers and screen them for any symptoms.
Officials at WHO and the International Federation of the Red Cross have advised against any travel restrictions to stop the spread of mpox.
From the IFRC side, we do stand with what is recommended under international health regulations, which is that there's no need to close borders when we are in disease outbreaks. Diseases don't recognize borders. People will continue to cross a border, whether it is a legal crossing or an illegal crossing. It doesn't stop a disease from spreading.
The European Centre for Disease Prevention and Control raised its risk alert level for mpox and asked countries to maintain high levels of awareness amongst travelers visiting from affected areas. Mpox transmits through close physical contact, including sexual contact, but there is no evidence that it spreads easily through the air. The new offshoot has caused global alarm because it appears to spread more easily between people. Bureau Report, DD India.
And our correspondent Chris Okamringa is joining us from Kinshasa. Chris, with mpox upsurge in Africa declared a global public health emergency by the WHO, how is Congo, with more than 96% of all cases and deaths, dealing with this major health crisis?
Well, the health minister in the Democratic Republic of Congo said that they're stepping up public awareness campaigns, prevention and treatment of patients of mpox, but the country is really struggling because the disease has spread to all the provinces across the country. This is the second largest country in Africa with a population of about 100 million people. And so far they have recorded more than 15,000 cases and 548 deaths since the start of the year. Now the DRC is really facing a lot of challenges because the country has been dealing with a war in the east that has really taken up a lot of resources that were supposed to go into healthcare and education. So the government is really struggling to deal with this outbreak. It also has the vast majority of the population is living in remote areas of the DRC, and there are very poor health facilities in those areas. The country has only one national laboratory in the capital, Kinshasa. So many of the people in those remote areas have no way of knowing what they're suffering from when they contract this disease. And so the government is now relying heavily on international health organizations like the World Health Organization and UN, Doctors Without Borders, to try and contain the disease from spreading further.
Right. Also, Chris, what's really different about the current outbreak in Africa compared to the 2022 epidemic?
So in June this year, a team of scientists traveled to the east of the DRC and they discovered a new strain of mpox known as clade 1b which is said to be more contagious and deadly than the one that was announced globally in 2022. This strain is said to be sexually transmitted, mainly sexually transmitted, although it can also spread through close contact with people who are infected or wild animals. And the DRC has a lot of forested areas, especially in the west and central parts of the country. And the outbreak that was announced in 2022 was quite mild. Many of the people who got the disease got cured, but this one is said to be very fatal, and many people have died, and that is why the World Health Organization decided to declare a public health emergency of international concern. Now, that declaration will enable the global health body to mobilize resources and deal with this outbreak in a more coordinated manner.
Right, Chris, thanks for joining us from Kinshasa.